And we're recording.
So let's start.
We'll start soon. We have people joining right now.
Okay. For 8:43, 2 minutes we have also.
Everybody will start shortly. We're just waiting for a few more people to arrive. Thanks for joining, everybody. We're going to wait for a few more attendees to arrive. We'll start very shortly.
Hi, good afternoon. Hi, Ben. Hi, good afternoon.
Hi, Saadiyah. We're starting very shortly. Thanks for joining, everybody. We'll start very shortly. We'll be starting very shortly. People are still arriving. Thanks for joining, everybody. All right. Thanks for joining our webinar. This is a webinar hosted by Disaster Accountability Project and SmartResponse. I wanted to tell you a bit about SmartResponse and welcome our panelists. I hope everyone is doing okay given the COVID pandemic. The Disaster Accountability Project was started after Hurricane Katrina about 13 years ago. to focus on improving disaster relief and humanitarian aid by focusing on implementing lessons learned, making sure that gaps are addressed. And through our work, we've focused extensively on improving accountability and transparency in the humanitarian sector. Over the years, our investigations focused on public health emergency planning, investigating fundraising and activities after the Haiti earthquake and Nepal earthquake, looking at evacuation planning surrounding nuclear power plants. And one of the things that we've really focused on is the lack of accountability and transparency, and really the lack of localization in the humanitarian sector. We find that after disasters, a lot of the money donated ends up not reaching local NGOs and nonprofit organizations. And we could keep reporting about this problem for forever, or we could actually do something about it. And our position is that this localization agenda and allowing more resources to reach local NGOs is not going to solve itself, and requires an intervention. So Disaster Accountability Project launched the SmartResponse platform as an intervention to allow organizations around the world to register and share data about their activities and their organization's work, so that we can curate localized lists for how to help when disasters happen. The idea is that if donors had better data about which organizations were operating around the world when disasters happen, they can donate to those organizations directly and bypass unnecessary intermediaries. Really, you think about it, in 2020, organizations around the world can access resources themselves and decide how to spend those funds and be trusted to spend those funds. And ultimately, especially given the current economic situation, local organizations are going to need to be able to access funds directly and have less waste and funds bypassed and diverted before they reach these local groups. So SmartResponse currently has over 500 organizations from 49 countries and 22 US states and territories, and we're trying to get to a couple thousand so that we can have smartly curated lists for disasters around the world. The platform itself is easy to use, and organizations have profiles including maps that show where they're operating, their service area, and really almost like a common grant application worth of data. So when these organizations are on the ground working after disasters, some of them even without power after an earthquake, for example, and unable to do the media and communications work and fundraising needed to keep their lights on and keep them working on the ground, this information will be available for donors to use to support them directly in the immediate aftermath and mid to long-term recoveries. So that said, we'll have additional webinars focusing more on SmartResponse in the future, but I want to focus our attention today on the organizations joining us. We're joined by Saadiyah Hassoon, the president of Together to Protect Human and the Environment Association in Iraq, Abid Lashari, CEO of National Disability and Development Forum in Pakistan, Bhakta Singha, Executive Director of the Community Development Forum in Nepal, Susan Van Ness, Chief of Programs, the National Diaper Bank Network, and Alliance for Period Supplies in the US, Quasi Babe, Executive Director, Participatory Development Action Program, PDAP, in Bangladesh, and Denise Santos, President of Banco de Alimentos de Puerto Rico, here in the US, and she'll be joining us shortly. So on this call, I'd like for each of our panelists to speak for 5 to 6 minutes, really about what they're dealing with on the ground right now, any lessons learned that they can share with us, and really what they need. It'd be great for them to tell us what their needs are right now, so that donors and journalists on the call have an idea and can more accurately report and also support the efforts of local organizations, both on our call and globally. So I'd like to begin with Bhakta from Nepal.
Everybody, greeting from Nepal. I am Bhakta Singh, Executive Director of CDF Nepal. We know Nepal is located between India and China. This COVID-19 started from China and also emerging large scale also India. So, we are under lockdown since 15 days, 24 months in Nepal. Now PCR test only 22,000 and RDT test only 62,000. Total 84,000 in Nepal tested, but the population is 28 million of Nepal. Total identified case is 246 and recovered case only 35 here. On the quarantine, 1,500 and say 50,600 persons are under quarantine till date. CDF Nepal has been working 25 years in remote and hilly area of Nepal, especially focused on the Karnali and the Sudra Far Western province. These areas are very difficulties in community, no job opportunity, no health service, no education facilities in this area, on our area. So more than 2 million people, minimum 2 million people goes to India for labor migrants. This is also a big challenge. To work hard, to work in mind. Beginning of January, when the COVID-19 start, we are involving, coordination informal meeting with national, provincial, and local level governments to plan for prevent, testing, treatment, care, and support. Coordination with national, provincial, and local level stakeholder, NGOs, and INGOs. We worked. We are handling 5 different projects in many communities. So we organized first our executive meetings, staff meetings, our board meetings. Then we decided to include this issue COVID-19 with first priority and the integration with our projects, all of our projects. We also start. Then we provide our executive board, our members, our staffs and volunteers to awareness in community. We mobilize immediate. We broadcast message on COVID-19 through local message and print media. We did. We collect actual situation of community people and effect of lockdown. That was also our major works. We regular informal coordination meeting with stakeholders. Also we did. In this period, Caritas Nepal agreed to support, to provide poor peoples. So we distribute more than 200 households, food items, and sanitizer and soaps for the poor people in our working area, remote area of Nepal, in Doti. Now we are doing such activity in our internal source. Now also we are broadcasting message on COVID-19 through local FM and media, regular formal and informal coordination meeting with stakeholders and for situation analysis, awareness campaign in community, coordination with different donors, different organizations to source resources to the support affected community, online meetings, webinar trainings we are doing now. Our top needs government, the needs of Nepal is test kits and human resource, lack of human resource and test kit shortage. NGO, like community, they are food, sanitizer, treatment service and quarantine services for the community. But CDF Nepal, like NGOs, we need capacity enhance, trainings, materials and funds. Situation identify and record keeping also challenge because of Nepal and India open border, more than 2 million labor migrants are returning home immediately. So it's a big challenge. Their test, counseling, treatment, livelihood, and employment. That's the challenge of our to work in community. Lesson learned in my, in this period. This is a worldwide pandemic. so no one is safe. No one is safe. So safest to a specific area. Our care and support first and save other. First save and save others, or that's our lesson learned. Third is regular coordination and follow-up. Is very neat in the community and everywhere. To attention to actual situation with reliable data source. To manage quarantine and counseling them for labor migrants in the Nepali community. That's our lesson learned. Jointly and close coordinate with work, the local government and the stakeholders to work. I would like this webinar to achieve for our organizations. Networking is the important global, networking is this global platform who are involved different disaster response. That's very important for me and our organization. We need also capacity enhance trainings, share knowledge to each other from this webinar. We need also, we would like to achieve materials, funds sustain in campaign this COVID-19. Thanks to all, thanks all of you to provide me this opportunity to participating in our webinar there. This COVID-19. Thank you.
Thank you, Bhakta. Next, Quasi, if you could present to us, please.
Thank you, Ben, and good morning and evening from our side, because now so I'm Kazi Baby. I'm the Executive Director of Participatory Development Action Program in Bangladesh. COVID-19 has been increasing dramatically and situation become worsening by day in Bangladesh. Our government is giving emphasis on the health sector because newly 2,000 doctors and 6,000 nurses are for this COVID purpose. Because you know there are no trained and trained health workers in our country. So that's why government giving emphasis for testing and for taking care of coronavirus affected people. So, and in current situation, the low income and disadvantaged people a lot. They are not able to afford their day-to-day livelihood, and the most need hygienic facilities to save their lives. They have lost their works. They do not have money to buy their daily foods and life-saving hygienic materials. We paid food items, some soap and some masks to our poor beneficiaries just for a few days, 10 or 15 days, for 500 families. And we also tried our the community people with our hygienic tools for them how to hand washing and using mask and using hot water. So, in the beginning, end of March and beginning of April. But
hey, Quasi.
Lag was increasing. Yes, can you hear?
Yeah, maybe if you turn off your video, maybe there'll be more bandwidth. Try turning off your video and there can be better voice quality. Thank you. We can try.
Okay, can you hear?
I think it's better.
Is it good?
Please proceed.
Okay. So at the beginning, we provided food items, soap, and some masks to our poor beneficiaries just for 10 to 15 days for 500 families, and aware the community people with our hygienic tools like how to hand washing and using mask and using hot water, etc. But when lockdown was increasing, then our government urged all national and international NGOs, private sectors to extend their supports to work along with the government to combat the corona crisis situation. After mid-April, you know, our there is a big organization, BRAC, and some organizations have taken an initiative the GO, INGO, and government will work together for the needy people through collecting data in ward basis. So our mayor of North City Corporation wanted to help NGOs and given assurance to support the needy people in urban areas. Then local councillors of 7 ward called meeting and formed ward level committee, and each ward there were 10 subcommittees have been formed who were collected data area basis for poor and needy families. Total 15,000 families data have been collected from our ward, and our organization, PDAP's 2 staff and 3 community volunteers are involved with 2 subcommittees to help the COVID affected poor people within this process. The top needs are mainly in our country, especially in urban area, food items and hygienic items to survive. As our poor people, they do not have any source of income now and they need work, so they do not want to follow the lockdown system because they need money and they are opening shops and small businesses to sell their items. So one of the major challenges is distribution of necessary food and essentials to the appropriate people in the hard to reach area in the lockdown situation. Besides even having precaution, health safety of staff working at the outdoor in the field is also a major concern for organizations. And there are another important issue, the domestic violence and sexual abuse are increasing due to lockdown. Because in the poor community, in a small room, 4 or 5 people are living. So it is happening not due to decline in violence, but because women and girls are less able to seek help through normal channels. They live in one room, so what to do? They are not able to go outside. And lesson learned from our activities that our capital city is very congested. You know, Dhaka city is very populated city. So especially the poor area, and very difficult to find out accurate needy people in the community because lack of manpower. So very limited manpower we had to collect the data. And also the fund availability, of course, it is very important issue. And this is the present situation. And we think the orientation to all volunteers and caregivers of organization is important. And also to communicating with the various government, non-government and donor organization on social media, email, Skype organizations, and who are distributing food items, healthcare to the beneficiaries and distressed people in the project area, also important to communicate with them. So, and also we think that short-term and long-term planning would be needed for this crisis period. And it is also need to ensuring involvement of all relevant stakeholders, including private sectors, NGOs, CSOs, INGOs, and donor agencies who are working in our country. So I think at the moment it is very important to help the poor people. Thank you.
Thank you so much, Kwazi. So there are a couple questions coming in and we'll answer those. We'll have a question answer after the presentations are over. So Abid, Lashari, please proceed.
Yes, Assalamu alaikum to all, and good night. We have night time now, so I will say good evening and good night as well. So we are working for the person with disabilities, especially for the rehabilitation of children with intellectual disability. In Pakistan, and I would say that in our the developing country, there is a dire need to work on mental health and mental disabilities. Children with intellectual disability like Down syndrome and autism and learning disabilities, ADHD, these children, they live their life very difficulty. Our other disabilities like physical disabilities, hearing impairment or visual impairment, they can live their life with all kind of the enjoyment, but children with intellectual disabilities, they don't. So we have established a rehabilitation center for the children with intellectual disability. Those belongs to in rural areas. Now, they're far away from Karachi. Karachi is our big city and is a capital one for the Sindh province, but our other districts are very far away from Karachi. So the children with intellectual disability, they cannot travel to the Karachi for their rehabilitation services like physiotherapy, psychotherapy, speech therapy, and occupational therapy. So that we have established one rehabilitation center for the children with 200 intellectual disabilities, and we have established it in Nawab Shah. We have the facility of the all life therapies, physiotherapy, psychotherapy, speech therapy, and occupational therapy, but these services are now stopped because of COVID-19. Before COVID-19, we have regular services, and we have our operation head for other projects as well from USAID, DI. It is on the peace building, and we had also skill development projects. All projects were went into the on hold position, but this center was providing these services. These services are the time taking process. We need the regular services, then we can bring the solid impact for these children. So now from 15th of March, our center is closed, and we have 2 months our children are at their home. But some children, those we provide the shelter them as well. We have boarding facility. These children we have with us, but the government has announced the lockdown in the city, so the government has banned the activities of children in our city as well. So children cannot come regularly on our center, so that we can say that they are losing 2 months our services that we did for their rehabilitation. Now we are losing for all efforts of 2 years. But the children are at their home, they cannot provide these services. But we have also boarded facility children. We have only for the shelter. We provide them precautionary measures, we provide them food, but we cannot provide them rehabilitation services because our staff is on leave. So that our operation is very disturbed because of COVID-19. For this platform, I want to say that there is a dire need to resume our services. So we need attention of all our listeners, our donors here, that this kind of facility must be restored. Children with intellectual disabilities, the 200 children will go lost their services, and they will not avail this facility. If they come after 3 months, we will start the facilities from the zero. These children belong to very poor families. Some households belong to the mothers. Those are beneficiaries of Benazir Bhutto Shaheed income support program. We have also cash grant program by the government for the poor women. So they earn only 15,000 to 18,000 monthly. They cannot pay the doctor fees, fees for physiotherapist, occupational therapist, speech therapist at their clinics. So it's very hard that they need for the restoration. The people with disabilities are very affected in our this current situation, so that we are also doing for the adult with disabilities. Those are the family headed persons as well. uh, because of lockdown, because of COVID-19, they are most vulnerable, they are affected. We need attention for them as well. National Disability and Development Forum has worked with some organizations at national level here in Pakistan. We have provided 675 food bags among for persons with disabilities in our Sindh province. We have 6 districts that we have provided food supply for the person with disabilities. But persons with disabilities are very vulnerable. They cannot find the self isolation as well. The self isolation is good thing, and social distance is very good thing, but person with disabilities have their own needs. They cannot wear the mask because they uh, uh, they need the basic facilities. They rely on other people. uh, they rely on other people for their caregivers, and other, so that they need some support from other people. Say the social isolation and other things are very difficult for them. So they need other special protocols for their isolation, and especially for the quarantine center. Quarantine centers we have, but they are not accessible for persons with disabilities. The quarantine center have the washrooms, but they are not accessible for people with disabilities. The transportation ambulances are not even, they are not accessible for people with disabilities. So people with disabilities need very attention in this difficult time. The response, the COVID emergency response, it should be disability friendly response. So we need the attention for the donors, that they, whatever they announce for the projects, for their program, they must ensure the accessibility of people with disabilities. People with disabilities have a lot of hindrances and difficulties to meet it. So this is our voice, that our person with disabilities need donors, and especially for the rehabilitation of children with intellectual disability. National Disability and Development Forum need 25,000 to 50,000 USD only for 3 months temporary financial for the resume of activities at an NDF rehab center, because we have government funds, but government funds are halted because of COVID-19. We have local philanthropy, but local philanthropy funds are diverted to the COVID-19 response. So now we don't have the funds to resume our services. So it's very difficult to ensure the service for the children with intellectual disabilities. It was also a great lesson learned for our organization, that we, before COVID-19, we had also funds, but we did not establish an endowment fund for emergency response. So this is our lesson learned. Now we have established endowment fund, that if we have the endowment fund, then we can meet every kind of emergency. For this, the ways for public can help us, public can support us through their philanthropy, from their donor organization can join us, that we can work for the people with disabilities and for the restoration of this rehabilitation center as well, that our children can get the proper way rehabilitation. Thank you very much, sir.
Thank you, Abid. Okay, Susan, you're next.
Okay. Thanks, Ben. My name is Susan, and I work with the National Diaper Bank Network and the Alliance for Period Supplies in the United States. You won't see us listed in SmartResponse.org. I just want to start up front. You'll see the diaper banks listed, because those are community programs that work together to address diaper need. So when we talk about diaper need, what we're talking about is simply a lack of supply, an adequate supply of diapers to keep a baby clean and dry and healthy so that they can thrive. And in the United States before the pandemic, our studies showed that 1 out of every 3 households in the United States experienced diaper needs. So they had to choose between purchasing diapers or paying a bill or putting food on the table. We also provide period supplies, and we know that 1 in 4 women before the pandemic had struggled in the last year to purchase period supplies due to lack of income. So without those supplies, those are students that can't attend classes, or for working parents who have to provide diapers to a child care center when they go to work. If you don't have diapers, you can't leave your child at childcare, and so you can't work. For people who menstruate, that can already be a stigma. But for most of our clients across the country, the stigma of poverty and being poor even further complicates that. So a diaper bank is a solution to that, in that it focuses just on this very narrow goal of collecting and warehousing and protecting a supply of diapers for the community at large. So they distribute diapers mostly through existing community organizations. So sometimes they distribute them directly to people, but they mostly are working with food pantries and shelters and schools and other resources in the community. So diaper banks are already in many communities when a disaster hits. For example, in March, the Nashville Diaper Bank, things started in the United States, things started to close down. There was talk about social distancing, and a tornado hit in Nashville. So the Nashville Diaper Bank had to look for their warehouse space and figure out at the same time, while they were dealing with a news increase in people who needed diapers because of the tornado, and that displaced some people, and also figuring out where they were going to distribute this tangible good that people need access to. So I would say that for the diaper banks, the top need is actually still being recognized as a basic need. So there's no, in the United States, there's no federal assistance program that addresses diaper need or provides help to families who need access. And there's really only a couple states that include period supplies in their budgets for their schools. So they have budgets for soap for washing hands in the bathroom and toilet paper. And some of them struggle with that, but almost none of them have money in the budget for period supplies, even though half of the students need that. I think that one of the challenges is that even for government, people who are advocating for government assistance or granting organizations or foundations that do address basic needs, they're almost always focused on food and housing. And so that is how awareness raising is an issue. And people don't realize that diapers are expensive and that babies just use so many diapers. So that's definitely a big issue for us. In the wake of COVID-19, it definitely has hit our volunteer program. So our volunteer programs having to shut down has been a tremendous detriment to our diaper banks. Volunteering has been a huge part of what makes a diaper program successful. And when social distancing and quarantine came into the United States, that also affected some of the fundraising events. So our diaper banks have taken a hit in that aspect, that they don't have the volunteers and they don't have the fundraisers. They also had to advocate in the beginning just to be considered essential workers, and they did that. They figured out how to address a sudden increase in the population of people who had gotten laid off, didn't qualify for unemployment, or for whatever reason suddenly did need diapers. It was a little chaotic. They figured out how to do kind of drive-by distributions of diapers, loading them up in trunks, or trying to distribute them along with food programs that were picking up what wasn't happening with school lunch. So there was a kind of an immediate realization of how many families rely on the school lunch program. And that allowed us to say, like, and diapers and period supplies too. Like, all of those things are things that people need help with. And so it's been a challenge for us to just, for many of our diaper banks to stay operational. They're all independently operating 501c3 nonprofit organizations. Each one is an individual nonprofit. And when a diaper bank closes, it doesn't just leave it, like if it can't operate anymore, it doesn't just leave a vacuum. There's all of this old information that they've worked to put out about partner agencies and where to go to get help. And so it creates a lot of chaos. And so our biggest challenge for our diaper banks and period supply programs is to just help them stay open and operational for as long as they possibly can. The lessons learned from this and from past disaster response is to not let the moment pass without using it to shed light on the issue, which is that there are bigger systemic problems. We have diaper banks in Miami, like Miami Diaper Bank, the Diaper Bank of North Carolina, who have experience in doing disaster response when a hurricane hits or when there's flooding. And they grow their capacity to meet the need, and then the media attention and the spotlight passes and it moves on. And I know that probably that in itself, as we've worked to raise awareness, like sometimes, you know, it's hard to even like have people be aware of these issues and challenges and barriers that people experience just to begin with. But we have learned to take advantage of this, what I would call situational poverty that comes up from a crisis. So on a day-to-day, normal poverty, you know, is the issue that we deal with. And then when there is a disaster, we have an opportunity to raise awareness about something. So the Greater DC Diaper Bank did a lot, and a few of our other diaper banks in the United States. The federal government shut down because they couldn't approve the budget for several months. And there were people who were out of work temporarily, and there were people who probably were one paycheck away from a financial crisis, who experienced short-term diaper need and a short-term financial crunch. And the diaper bank was able to address those needs and help the community to deal with those issues, but also made sure that for all of those people who experienced that temporary situational poverty can now advocate and say, you know, we remember what it was like. And I think that is something that we try to, with the diaper banks, to utilize as well now. We want to make sure that people realize if you can't get what you need at the store, either because it's available or because you can't get to the store, that is what it's like to not have your basic needs met. And it's stressful and it's scary and it creates all kinds of other complications. So we're really trying to use disasters. We try to respond to them, but we also do try to address things like in the United States, if this is your first time in isolation, that's kind of a privilege. You know, be aware of the fact that for refugees, for poor people for whom transportation and getting around, this is not the first time that they've been isolated at home or been able to get their basic needs met. And that lesson helps us sort of take advantage of the opportunity to demand that the government address diaper need and period poverty and not having access to these basic things that are just necessary to show up for school and to show up for work. I would say that the ways that we need help is, of course, donations to the diaper bank. They purchase diapers or they receive donations for far better prices than when people donate products. However, because we still have to do a lot to raise awareness about diaper need in communities in the United States, we also encourage people to host drives and to still organize to donate diapers to local agencies like food banks or shelters or any kind of centers where there are people who need them, because that sheds light on what this need is and what it looks like and where people are in their actual communities. And once we make an issue visible, we can grow a program there. And then, of course, advocating. That's another area where we need help. So thank you.
Thank you, Susan. All right, Saadiyah, you're up. Saadiyah, you're on mute. If you can disable your mute, or I'll help you with that. Go
Okay,
ahead.
good afternoon. Thank you, Ben, for invitation to share our work and our initiatives in Iraq for our organizations and also for other organizations in Iraq. Because actually, I'm proud that all the NGOs in Iraq make in a solidarity way that work to support all the vulnerable people in the cities and in the rural areas. For our organization, Together to Protect Human and the Environment Association, we are concerning of environmental issues and development issues for education and youth. And also to provide some alternatives for environment-friendly products like eco bags and all the things. But when the crisis started in March, we started to change our tailors to start sewing, provide masks from fabrics for the children and for the people, and distributed in Erbil, in north of Iraq, where our organization is located there. Also, we have volunteers and trainers in Mosul. We started to support people with food. Even we are not relief organizations, but our responsibilities toward our community at this time lead us that we have to work on this issue. In the development work, we started to use digital connections, online applications like Zoom, MS Teams, Google Meet, to keep connecting with our trainers and our volunteers outside the place that we are living in Erbil, in the neighboring, and also in Baghdad. So we started to put a plan to develop the skills of our staff and also the people. We started to give them training about time management, because we know that there's free time during the pandemic, and all the people sit in their houses and they didn't know what to do. So we give them about how to manage their time, or how to make this crisis like a grant, time grant for them to invest this time to build themselves, to build their skills, and to have more knowledge and information, and invest the capacities that we are as on organizations training skills to transfer it to other people. Also, we gave them about psychological health, because we know that many people suffer a lot because they didn't used to sit like more all the day in the house without work. So they have some fear, they have some they are upset, they are like afraid from the future, what they didn't know what to do. Domestic violence percentage rises in the community. So we started to give sessions about psychological health for the people and how to manage themselves. Also, one of the important sessions that we provide to the attendees of our online sessions is about how to return to our balance, to return balance and invest this time during, and we give them many examples of how to invest. Also, how to read books, and provide them with some list and websites of like libraries, online libraries that are offered free in this time from international libraries. Also, during this time, we started to put plans for our future work with international organizations. We are working with the Finland organization, FIDA, and with UNFPA on youth and on education, for child education. So we invest this to plan for the next steps after coronavirus. What should we change? What should we focus on? And we change that health is one of the main issues that we have to add to our plans in the next in the future. Also, we follow up with the NGOs office in Baghdad, who led the initiatives for all NGOs in Iraq, and they like organize their work and document their work. And there's a weekly report, as my colleague Muhammad writes here on the chat, like about 7,700 organizations, NGOs all over Iraq, working every day with facilitation from this NGO office to go even during quarantine to support the vulnerable people, taking precautions of like wearing masks and gloves, and also they started to do not just the relief, also they participate in sterilizing the places, the special crowded spaces, the markets, the schools. Also they have do awareness, put posters and distribute some brochures. Online also there's a big campaign for online awareness for the people. All these activities documented and issued as a weekly report in details for all regarding their classified as governorates, as districts and sub-districts. Even the situation in Iraq is not so bad as in the US or in the Europe. Till now, the registered cases is about 3,000 cases, but the health situation is not as much as good as we need. So I think we are proud that the solidarity of organizations in Iraq did great work with no support from any international organizations. I think just 6 international organizations participated in very small contribution, but all these donations from the local people who support each other. This is what I have to share with you. And actually, with the lessons learned from this period, that the governments and the civil society organizations should put in the plans, and also to benefit from the database that are for the vulnerable people, the geographical distribution, how we can reach them in the future. This also benefits the government when they put their plans and make their yearly budget. So I think Corona, we look to coronavirus is not as a negative impact for us, and I think for all the planet, it's a positive regarding the emission, the ozone layer, and also we have a clean environment now. So thank you very much for giving this opportunity, and thank you for all attending this session.
Thank you, Saadiyah. Okay, Denise, to close us out, we have a couple questions and we'll try to get to those after. Denise, please proceed. All right, you're unmuted. Go ahead.
Okay, and is the video on?
Not yet. We can hear you.
Okay, but are you going to put the video or not? Or the
Oh, you can put your own video. I can try.
I thought I was trying. Okay, okay. It's
there.
Sorry.
You are.
Okay,
Hi.
thank you. Okay, good morning. I am president of the Puerto Rico Food Bank, Banco de Alimentos de Puerto Rico. And to give you a brief background story, Puerto Rico has been experiencing a number of different crises as we started 2020. We come from around 15 years of an economic recession. 32 months ago, we were hit by 2 hurricanes, one right after the other. That's Irma and Maria. So we have not been fully recovered. And as we started the year in January, we had a 5.8 earthquake, which hit the southern part of the island, and it destroyed, you know, a number of homes. So we had a number of families that had to be moved to outside locations, baseball parks, and many others. So we continue having tremors. Just 2 weeks ago, we had another 5.2 earthquake, and that has created a very strong emotional response from the population. And now we are facing COVID-19, so that just continues to add up to the emotional stability of the people in Puerto Rico. Regarding COVID-19, we have been in lockdown since March 15. I think that was a very smart move from the government. We started our lockdown early. So we are not in a very dire situation with regards to our hospital requirements and so forth. But we continue to be in lockdown, and we'll probably be in lockdown through at least May 25th. This has created a number of situations that are contributing to a level of desperation and anxiety by the Puerto Rican population. We have basically closed all businesses and all economic activity in the island. So there are more than 300,000 people that are, and just for your information, Puerto Rico has a population of 3.2 million people. So right now we have over 350,000 persons that are applying for unemployment benefits, and they have been without receiving any sort of financial aid, either local or federal, for the last 8 weeks. Besides, all the schools are closed, so none of the school lunchrooms are open, and many kids in Puerto Rico, 6 out of 10 kids in Puerto Rico, suffer from extreme poverty. So they rely a lot on the school lunchrooms for their daily meals. So the fact that the school lunchrooms are not open, it's creating a crisis in our children because they're not receiving any hot meal during the day. The government is totally closed, so it's very difficult to get anything done that is related to trying to get approvals and trying to get government support for many programs. So basically, we are all in this alone. Many organizations that are dedicated in Puerto Rico under normal circumstances, that are dedicated to food distribution and food support, are closed because of the lockdown. So there are only 3 organizations that are at this point in time distributing food around the island. Now, what Banco de Alimentos has been doing is basically we realize that we can't supply or we can't replace what the government is supposed to do with its population with just us and 2 other organizations. So what we're trying to do is try to expand our reach as much as we can. We normally work through 150 agencies, churches, and other nonprofit organizations in our food distribution process. These organizations basically reach over 1 million people a year, and we distribute over 13 million pounds of food annually. Now, we have also, we continue supplying through these organizations, but we have identified 22 different distribution points around the island, so to be able to have some sort of a presence in the northern, southern, east and west and central side of the island, so that people don't have to come all the way to Carolina to get some food. So we are basically distributing through these 22 depot centers. And we have also, we realized that it was very difficult for a lot of people to receive, for us to be able to distribute emergency food boxes to as many people as they are in need. And with the social distancing and the lockdown, we are not able to do anything that requires groups of people. And what we usually do is take our truck to all these different communities and distribute these emergency food boxes. And there's usually a line of people waiting for it. That cannot be done at this point in time because of the lockdown and the prohibition by government that people meeting groups. So what we're trying to do is basically go home by home. So it puts an additional pressure on the food bank. So we decided, instead of putting all of our resources into emergency food boxes, we purchase or we acquire hundreds of supermarket gift cards. And we are distributing these gift cards, you know, to people for them to go and do their own shopping, so that they don't rely as much on the food bank. We're also purchasing some certificates of fast food restaurants, so that people that are in real need can get, you know, can grab a bite to eat immediately. We are also trying to trying to work with different local organizations that have some sort of a kitchen to be able to provide food, so that they can cook hot meals every day. And it's really putting a lot of pressure on the food bank, because we receive hundreds and thousands of calls a day from people that are desperately looking for food. There is a big number of people in Puerto Rico that have been without receiving any sort of income for 8 weeks, and we live from paycheck to paycheck. So this puts, you know, a pretty big burden on our social responsibilities. So that's a little bit of what is happening in Puerto Rico. What we have learned is that relying on the government during emergencies usually doesn't work too much. So we have an alliance of different non-for-profit organizations, and we've basically tried to do as much as we can within our support group. So that's basically what I have for you today.
Thank you, Denise. Thank you to all of our panelists for presenting on what they're dealing with and their needs. I want to quickly answer any questions that have come up. I know we're over time now. I know Roof over at GNDR in Bangkok asked if there are any government regulatory restrictions imposed on CSOs going out to the community to help that are fighting COVID. I know in the Philippines there are many challenges for local CSOs in the community. Is anyone in this group can discuss challenges for CSOs due to government regulatory restrictions right now?
Actually, Ben.
Yes.
In our country, there is no regulatory act. So due to lockdown, the people should stay at home, and without important work, you should not go out. And if you go out, you have to wear the proper precaution, like mask and hand gloves, and also the PPE. if you don't have PPE, then you have to think how you can give reply to the police if they ask you why you are going out. Huh? So this is the thing is going on. But we are working when we need to buy some foods and some other things. We need to buy then important medicine. Then we can go out. But restriction is government is area to area announcing that you should not go out, you stay at home. So this is the important issue for due to lockdown. Actually, there is no any regulatory act from our government side. But now it is, our Eid festival is coming on, so people are opening shops. Government has given permission that you have to follow the social distancing, and then you can open the shops. But people are crazy, the people who want to go out and they are not maintaining the social distancing. This is the happening actually in our country.
In Pakistan, we have no any kind of restriction, but before COVID-19, there were some restriction on CSOs for foreign funding. So there was a regulatory to get the MOU with the government of Pakistan. After the COVID-19, government has relaxed their regulation to find foreign funding, and there is no need of MOU with the government. So in Pakistan, there is no kind of this kind of restriction. Still this time, we do not, this kind of action has been reported in our Pakistan.
We have a comment that there are challenges in Myanmar. In the Q&A, you can see a comment from one of our participants. So we're over time, but we have a suggestion for a future webinar on how NGOs are getting funding in their countries and how they ensure quality and accountability, and how are resources going through local NGOs. I think that's a great suggestion for a follow-on webinar. And so I'll be in touch with organizations in SmartResponse to see who the panelists might be, and we can have that in the next couple of weeks. I hope to do more of these webinars with members of the SmartResponse community, both internally and externally. I hope this has been useful. If anyone is interested in supporting organizations on the ground, I encourage you to both look in your community to see which organizations are responding, but also check out smartresponse.org, and you can search for organizations by location, also by disaster. If you have challenges finding organizations, you can always ask, and I can point you in a direction. But I think you've heard today from leaders of organizations around the world that there are many, many capable people on the ground working very hard that need resources. And I think a lot can be achieved by supporting organizations directly to do the work that they're doing. And I wish you all the best. Keep up the great work, and hopefully we'll see the end of this crisis sooner rather than later. So thank you for joining us. Thank you for attending, and we'll do more of these webinars together. Thank you.
Thank you. Thank you.
Thank you.
Thanks. Bye, everyone.
Thank you.
Thank you.
Bye. Bye. Bye.